What's your name?
My name is Carina.
What is your job title?
I'm an intern at the Timpani Center, and then I have previous experience as an EMT.
What did you do as an EMT? What does that entail?
Yeah, so EMT is first response calls. I mostly did IFT, which is interfacility transport. So we would receive calls at a hospital, at a skilled nursing home, and then transport from one facility to the other. Mm-hmm.
How do you define value to your clients?
I think with that's such a personal question. I think it depends on the client and really determining what is that motivates them and then finding out where those values are. I think that I have a very specific kind of values already, and I would like to work with patients where our values align.
How would you deliver those values to your clients?
I think from the first interaction where we start to really get to know each other, like our first sit down where we talk about our goals, why we want to get to those goals and what is motivating us. And then as you get to know a client longer, you can connect those.
A lot of clients feel like their relationships with people are transactional. How do you keep your clients connected to you?
So similar, again, I'm a talker. So the more I can interact with a client, the better it is for me, just because I like to really connect with people. And I don't want to come in. It would be really easy to come in and do a workout and leave, but that's not what I want to do. I want to come in and talk about, the weekend or the days that we haven't seen each other. Talk about what their life is outside of this specific workout or interaction because I want to see someone more than just like where we're at now and seeing them outside of their injury or their goals.
Reuters reports 55% of healthcare turnover. Have you noticed that in your field?
Yeah, so in EMS, it's really common for there to be a fast turnover rate. I think for really overworked and the burnout rate is really big, and I think that comes down to the training that we receive. I think there's a lack of like mental health training where you're not necessarily prepared to see the things that you see on a daily shift. And the only people that can relate to that is other people in the field. It's really hard to come home and explain that you saw specific codes. So I think that contributes to the turnover rate, but also we're really underpaid. So you're doing a lot of work, long hour shifts, like you're doing 12-hour shifts and not making nearly as much as you should.
As a healthcare professional, how has burnout impacted you personally?
Yeah, I was really burned out where in EMS, I would do night shifts because of my school schedule. So I would go to school and then do a full 12 and then not really rest between the next day. And also there's a lot of call outs. So sometimes you would get extended. So you would do a 12, get scheduled 2 days out, but then you would get extended for 12. So you end up doing a full 24, which isn't sustainable whatsoever. And I really had to decide whether the field was what I needed at that time, because I also needed to focus on schoolwork. I also needed to focus on my relationships outside of work. And that became really hard. It became really isolating, having to do long shifts and not necessarily having a choice, because you know that people need the care. And the only other people you would see that would understand that is, again, people in the field, and it just continues on.
The United States faces shortages of 700,000 healthcare professionals by the year 2037. What is one move businesses must make now?
Well, specifically in Santa Clara County, where EMS is privately owned, I think it's important for the county to own it, just to improve wages and also improve working conditions. I don't think there were people, so if you were a full-timer, you're able to receive benefits, but you were also expected to do the full 12 and then get extended another 12 if needed. And then that leads to you working an insane amount of hours. And the way to work around that is to become a part-timer where you still work the same amount of hours, but you don't receive the benefits, but you're not expected to get extended for a shift. So you can leave, you can clock in and clock out, but that means that you're without benefits. And during the time where I was in EMS, I wasn't dependent on the benefits provided by the company I was with, but that wasn't the case for a lot of my coworkers. So I think it's really important for healthcare workers to be viewed as valuable and just for the care that they're providing, and that should be translated to the amount that they're being paid and the benefits they're receiving, and the care that they're receiving as well.
What are the most common rehabilitation goals you have seen working with your clients?
Well, my rehabilitation exposure is quite limited, but I do see a lot of I want to improve, and there's a lot of it requires a lot of self-motivation, and I've been able to see that just by the time being here at the Timpani Center, and then it's just like personal experience with PT, and it's a lot of personal motivation, and I think if you don't have that, it's really difficult to go through the sessions. It's hard to know that you're injured without having a personal reason to improve.
What are the outcomes that your patients seem to try to achieve most commonly?
I've seen a lot of I want to improve where I'm at. Like there's, for example, if like mobility was lost, it's really getting back to not necessarily where you were before, but just improving where you are now.
Could specialized robotics and gait training help your clients achieve those mobility goals?
Yeah, I think that's a field that's really it's developing, and I think it's exciting to see where we can go. Earlier, when Nolan shared a video with an exoskeleton, and I think that only brings a glimpse into what the future can hold for rehab. There's a lot of new technologies that could help in the way that, again, not replace a PT, but just help enhance that experience for everyone.
Knowing that the exoskeleton and robotics tech does exist elsewhere in California, how does it feel that this technology is not readily available in San Jose?
Yeah, again, it really comes down to the funds, and it's unfortunate that not every patient is able to access those new technologies. I hope that there's a day where that it becomes more readily accessible. But it is disheartening to know that there's new technologies that not every patient is able to utilize that could really help someone.
If a private grant covered 20 sessions of robotic therapy, would that help accelerate your clients' milestones?
I think so.
In your experience, are financial constraints a main barrier to ongoing rehabilitation?
Oh, absolutely. I think it's not even just with physical therapy on its own. I think there's financial constraints happen before injury, where I think there's a lot of injuries that are avoidable if you're able to receive preventative care. And if you're unable, let's say if you're unable to take a day off from work to go see your regular physician, where you get a yearly physical, if that on its own you're unable to receive because you're concerned about the financial strain of losing out on a day, like let's say your job doesn't provide any paid time off or sick pay for you to use that, and taking a full day off of work to really work on preventative care leads to you only going or receiving care once you're too sick. And from there, it's only going to get more expensive and the cycle continues. So I think there's financial strain from the beginning, the middle, and then post-care as well.
There are patients whose recovery stops once the insurance quits. Maybe they don't have financial resources or family support. Would you consider post-insurance discharge a critical piece that's missing in our community?
Yes, absolutely. I think that's part of the reason why centers like the Timpani Center are important, where they're facilities like for the land gym, where there's the machines are, accessible to not just manual wheelchair users, but just they're accessible to able bodies as well. But I think that's not common. I think that the reason why improving an injury stops after care is that you no longer have access to the facilities that you were exposed to. you no longer have that support that you receive from a PT or a PTA, or someone there to encourage you to do the exercises or encourage you through the way of, because rehab is really difficult. It's not something easy, and it's hard to do that on your own. And I think once you're home and you don't have the family support, or you're unable to access facilities that are catered to help you with your injury, then yes, it makes sense for improvement to stop there.
On a scale 1 through 10, how important is access to grants for specialized balance, gait training, or other rehabilitation purposes in our community?
I think I would say a 10. So like the Timpani Center is a nonprofit center, so we really depend on those grants, and I think it's important for the Timpani Center to continue to look for those grants where it's not just, for example, the arthritis class that is free to the public, that's providing care that, again, if you don't have the financial ability to pay for an aqua class, which is expensive, then you're not going to find it, and you're just not going to get exposed to that. But it also comes down to keeping the center, clean, getting new machines in, and then back to the technology we were talking about earlier. If we continue to receive grants, that could be a possibility to integrate new technologies and help the community that's already here and present at the Timpani Center, but also bring new members in.
Grants are important to continue the growth and updating of nonprofit organizations such as the Timpani Center. On a scale 1 through 10, how vital is funding for patients once insurance stops paying for them?
I would say 10 again. Guess like the Timpani Center does offer personal training, but that is also expensive. I think if there was a grant that would cover personal training, more people would be open to trying. I think it's scary leaving a facility that, again, has you leave a team that you really trusted, and it's scary stepping into a new facility and not knowing exactly what to do, what's going to help with your injury. And I think if we had grants that were able to cover personal training that with people who have been exposed to people with different mobilities or disabilities, if they're able-bodied or not, it's really important to receive care from someone who's been exposed to that.
On a scale 1 through 10, how vital is access to specialized balance and gait training technology in our community?
I would also say a 10. I think, again, it's scary receiving care that you are searching for care where you don't know where to start, and specialized care is incredibly important. You want to make sure that the people who are treating you know what they're doing.
How would a private grant for rehab affect the long-term health of our aging and disabled population?
I think grants that are for long-term care are also incredibly important, given that we're only getting older and our aging community is only increasing. So it's important to, I think, with grants going towards, getting personal trainers trained in aging and like knowing what exercises or what like community building treatments are best, and also like most up to date is really important, but also that's expensive. So if there's a grant that's able to cover that, and not just the class itself, but also providing the proper training for providers, would be helpful.
What do you know now that you wish you knew on the first day of your career?
I think my first day of career in terms of EMS, where I really viewed EMT as a stepping stone. I thought I was just going to get my patient care hours and leave, and I think that's a really common outlook on EMS, where you're there for the meantime, and you just have to get through it. And I wish that I would have received a bit more of mental health training, in terms of you're going to be exposed to a lot of things that aren't on the textbook, that aren't in the training you received during your EMT training. But also it is important work that you're doing. So reminding myself that it's important that you're there, and it's important to view it as something, also view, you're there with people at their most vulnerable. They need help, and it might be the scariest time for them, and you're there to provide the adequate care and also really care for your patients. And I don't think I had that exact outlook on day one. It's something I definitely developed by the end of it, but not on day one.
What is your message to people at work in the healthcare industry who are struggling to get the care they need, whether it's mental health or other?
Yeah, I definitely think it's important to search it and seek for it. There are providers out there who will understand, and it's also important for your patients to make sure that you're taking care of yourself and not so that you're able to provide the best care.
What is your message to other people working in the medical field who are suffering from burnout and they don't know what to do next?
I think depending on, the company that you're working with, reach out and see what resources are there for you. I know that you're not the only one struggling. It's a really common struggle for everyone in healthcare. And also finding an outlet that's outside of healthcare, whether that's, working out or being outside, being with a community that's not just EMS, and it's not just the healthcare community, who I think you definitely need to be pulled out of that when you're not at work. So look for a resource, utilize that resource, and then also really take time to build and maintain friendships outside of healthcare.
What is your message to a newly injured person or someone just starting to navigate the healthcare system for the first time?
It's difficult. I think it's important to advocate for yourself. You know what your injury best, and I think you're going to encounter a lot of providers who might only push for what your insurance covers, but I think it's important to do your own research. And then you can fire providers. You can definitely, if someone's not working for you, they're not aligning with your goals or your values, it's important for you to say, this is not the care that I'm meant to have, and search for other providers who are able to align those goals for you. But yes, it is a difficult time, but also know that you're not going to be injured forever, and that improvement can be made. It's just important for you to really advocate for yourself or have a community that's going to advocate for you. But it's, at the end of the day, it does come down to self-motivation and see why you want to improve.
There aren't any more interview questions. Is there anything else you'd like to say before we conclude this interview, whether it's to city officials, business owners, newly injured patients, other people in the healthcare? Any last words?
No, I think, nonprofits like the Timpani Center are incredibly important. They're doing important work, but they need to continue to have access to those funds so that we can continue to provide care to the people that need it. That's it.
All right, cool. Thank you.
Cool. Mm-hmm.